Well, Melissa and I were kind of talking, it's like, we kind of know what we're going to do at this point anyway.
Yeah, we were talking this
I
morning.
just cancel these texting meetings.
No, you're on. You're definitely on.
No,
Don't
we're
worry about
good.
it. No.
We're good.
I know we're good. We have cookies.
You're
and
the
everything.
facilitator, so it's
And I
up to
will-
you.
I've made slides.
Mhm.
I did. I've done my job. I
So
put
is your
2 memes in
microphone
there.
off?
I'm not joined by computer audio, and I've muted my speaker.
Okay.
Thank you for checking. Testing.
Looks like Jamie's on. Jamie, are you there?
That's her probably phone, right?
No, it's my phone. This is my number.
Hello, good morning.
Hello, Jamie. How are you feeling?
I'm okay. I'm much better than the rest of my family. So,
Oh, okay.
but I'm
The
gonna.
snacks are very good today.
Oh, the snacks are very good.
Yeah,
The best ever.
best ever.
Mm,
Well,
well, have
we
some
got
for
some-
us.
looks like we have some other people joining.
Good morning, Erin.
Good morning. How are you today?
We're good. It actually feels kind of balmy outside right now.
It was a nice warm morning today, wasn't it? It's ironic how in August you tell me it's 55 degrees. I'm going to tell you I need a parka. And now I'm like, oh, good. It's going to break 25. I'm so excited.
I know. I didn't even button my coat this morning. It was so warm.
You. Oh, my goodness. I went out to feed horses, and I'm like, oh, my gosh, we're going to have mud again soon, maybe. Wow.
Yeah. Not yet here, but we're hoping.
No, not yet. But it gave me hope today, at least.
Well, we'll wait just a few minutes and see who else comes in and give people a chance to get some coffee.
So here's how to face the window.
How are you? Good, fine. Hey, Chris. How you doing? So I have a opportunity for you. The wrong thing to say. Oh, what's up? We can talk afterwards. Yeah, let's do that. Let's talk. Yeah. But it's like, and she'll be happy because somebody else will do the data mapping. Oh. See?
Okay.
See? I told you.
She's all for that.
There you go. Looks like a biggie. It's a biggie.
Oh, is it?
Yeah.
Okay.
Yeah.
And then also, you know, the thing with the national cap, they had to be these. You were on the email chains, I mean, because I was out of the office. I've been out of the office the last 3 weeks when all this stuff was fine last year.
Yeah.
So they just put in incorporated, I think, your stuff. I don't know where it ended up.
So that's the storm that
I got to work with Jamie.
They got submitted and
north.
They submitted the other
The
one.
one.
Okay, we have room. We have time to do it.
Not much in.
All right.
Okay.
Yeah. Okay.
But it's for the.
University.
I was gonna say, that's normal. Oh, yeah.
But it has to be.
Sorry, the blizzard or the like.
All right.
I'm going there next week to DC.
Last
So
year.
we're gonna have a face-to-face meeting first, more along the lines of all of our other cap work we're doing around the country.
Okay.
To be able to expand it into other
Winter already.
All right.
Yeah, so, yeah.
Okay.
Let's see what happens.
Okay, doke.
Looks like we got a couple people on the phone. What's up with the cord here?
Have you heard of FHIR?
Refill my copy.
Let me pull up the actual word.
Morning, Jane. How are you today? Oh, you're fine. Yeah.
Oh, gosh, yeah, it's so cute when you can feel her foot.
Yeah.
Like the outline of it.
Yeah.
It's awesome.
I know.
Yeah.
Fast,
Yeah.
healthcare, interoperability resources.
Other than getting no,
Okay.
like
You know, they
time
support
when I'm trying to go
But
to
she's
sleep.
still doing that.
That's
She is,
great.
it's not
Autonomy.
your
She's
meal.
hiccuping or
Because
she's
people here make all
She's
the
hiccuping.
decisions.
I don't, yeah. But I'm seeing my doctor.
Okay. Smaller group,
Sure.
Okay.
I didn't know if you had heard
But she's been
about
in the same position for several weeks. So for clinical?
It's for electronic health records.
Oh, you gotta wait.
Okay.
Yeah, so it's the data mapping
Okay,
for electronic health records.
great.
So like if you have
Like we're
certain type of stuff, how would it show up in an electronic medical record?
Yeah.
Growing and vanishing.
Oh, no, that's your guy.
It might,
Stick
it
together.
might come out in
feel-
our conversation
Okay,
today.
okay, that's great.
Yeah.
There's no more, like getting all the accounts, like, we can't get all the accounts right now.
I
feel
said,
like
that's
you're
beard guys
keeping
stick
roll,
together.
Yeah.
You know?
Yeah.
Or call my husband.
Right.
Yeah, I never felt like
That's what I had
that,
the
but I
other
never
day.
did get these.
When the guy was chopping
Yeah.
wood with his hand.
Yes.
Going five
Okay.
times.
Oh,
Yeah. But
My wife was
anyway,
helping him with the
Oh.
logs, and he was just chopping them.
so no,
with
I
his
never
hand.
felt big. Anyway, you're looking.
Very manly.
Yeah, there's
You
more.
may want to you may feel the need to do that also.
It's where
You
you're
know,
more.
I'm doing
Yeah.
it.
they're growing
Yeah,
beard.
yeah.
We're talking
Trying
about,
to keep up my yoga.
Well, real men don't need to do that, as we know.
It all started when I left my shaving cream in Chicago.
I know about how you
That's
feel.
the story.
Yeah. Martha, she's growing. Do you have a name?
You're ahead.
I'm just
By the way.
lazy. I'm just lazy.
I'm not
Okay.
quite sure I like it enough.
You got a head start.
Right.
He's throwing like really weird things out there.
Oh, my husband did that.
He
Yeah.
gets offended when I don't
Get
like
that.
them. But if I say something like, no, that was my third grade teacher, he's like, well, I don't care. How can you get offended if I don't like yours? I mean,
Not, one of those big things that the kids would be made fun of
yeah.
if we.
Right. Voltarine was his latest. I'm like, are you kidding me?
Yeah, Wolfgang was one of my husband's.
Okay, all right.
Here, Wolfie. Yeah, that's the dog's name. It was the dog's name, actually. Our very first dog was Wolfie.
It must have been a good dog, then,
Yeah,
huh?
it was. I guess it was a good dog.
The best.
But he was just Wolfie, not even Wolfgang.
All right, guys, well, so a couple
Oh,
minutes.
sorry.
We have a few folks on the phone, just a few folks on the table, so smaller group today. So we go ahead and get started. We are recording our meetings again, so we'll pull up some slides here. So I'll kick things off, and then we'll turn it over to Melissa to talk about some of our findings. So the main purpose of today's meeting is to basically come out of here with some final recommendations as we begin to kind of scope out our build for the next year. So we'll again be reviewing the data list and asking folks actually to do a little exercise and picking some of the priority data sets for both personal and for kind of more general or public users or maybe engagement specialists. Be more familiar with your impact areas, and then we're also going to provide an overview of kind of what we've heard across the impact teams, as well as in our kind of one-on-one sessions that Melissa and Jenting have been leading over the last couple of months with folks both on campus and extension folks in terms of the priority use cases. So again, the goals are tools, data, both data sets as well as jurisdictions for the crosswalk tool that we demonstrated on the first session, and then also to talk about what your all's role may be into the next year in terms of both providing feedback on what we develop and facilitating the next round of sessions.
So we should do some quick introductions. I'm Melissa DiBartolomeo. I'm facilitating the meeting today. I'm with CARES.
And Angela Johnson with CARES, leading the Health and Safety Impact team.
I'm Dale Fitch with the School of Social Work.
Chris Fulcher, CARES.
Chris Barnett with CARES and heading up the Agriculture and Environment Impact team. I'm Michael Hardy with CARES, and I'm working on the Youth and Family Impact team.
And I'm Kathy Bowman. I'm with the School of Nursing.
And then we have a few folks on the phone.
It's on mute right now?
Do we have everybody muted?
Hi, this is Linnell. I'm with School of Health Professions.
And so, Angela, do you have the list of the names of the people that are part of the health and safety team?
Yes, somewhere.
Sorry, just because I wanted to, because this is the last meeting, maybe reaching out with an email afterward to the
Yeah,
the folks that
yeah,
didn't make it.
we'll do
We're
that.
glad to do that for all the.
But the good news is, we have a small group, and you guys make all the decisions now for the health and safety team.
That's right. And we also have Erin Magruder, who's muted, but I'll just speak for her. She's also on the phone.
Thank you.
And Jamie Feinsorge is joining us remotely as well.
Okay, let's get started once he decides to wake up. So just our agenda today, we're going to go through the use cases, like Angela mentioned, with these impact team meetings, as well as field studies that Shensing and I have been running, as well as RV meetings, as well as regional trainings, as well as impact or feedback from the summit. What else am I missing? The survey that we did. We've kind of landed on some use cases that we think are applicable across all the impact areas and wanted to get you all feedback on not only the use cases themselves, but what's a priority, anything that we're missing, other use cases that we need to keep in mind given timelines for other programs. And then in that, we'll talk about what we think or what we've heard should be public, what should be behind a paw print or a subscription. Then we'll take a break, and then we'll talk a little bit about data. And we spent all of the last impact meeting around data last time, so we'll work through some prioritization exercises like Angela mentioned, and then really hopefully not spend too much time hashing things out. And then towards the end of the meeting, we'll just talk about, okay, 2019, what are our plans and thoughts going forward? How can we solicit regular feedback and keep people in the loop and make sure that if a new feature comes out, we're in touch with folks in Extension who need to use it, and also understanding how folks are using it regularly. And I'm just going to turn red, so don't let that be a distraction. I'll blame it on the kiddo. Again, so the use cases that we have heard, here's kind of a list of all of the things. And I left out leadership. I apologize for that, but you know, if leadership has requested something, that definitely makes the cut. So across the multiple impact areas, the first group that we'll talk about is anything that's public on All Things Missouri. And so what we've heard is folks really want a skinny report to bring to, we're just calling it a county council report, but just to say, here's a broad overview of things that are going on in the area. And we heard yesterday that really two parts would be important to that report. One would be sort of a 1 or 2 pager infographic, like here's the population, here's some cool dials and charts that just give you an overview. And then the second part of the report would be a deeper dive, really getting into some of the areas listed up there: demographics, workforce, vulnerable populations, natural resources, and economic climate. And my question to this group, or our question to this group, is what are we missing on this report? What other considerations? So somebody coming in or someone in Extension saying, here's a real brief overview, you're a new county commissioner, here you go. Here's a, again, a 2-pager with some infographic information and charts, or a deeper dive. What else do they need to know? Or what don't they need to know?
What about morbidity and mortality? If you're looking for things that are global.
We did also hear related yesterday that trend information is really important. Like, how are those things changing?
Mm-hmm.
And also baseline to other places too, right? So like maybe how that stacks up against the state.
Or other surrounding counties, if we have some comparative regions.
Yeah, another question for both the county council report and for the deeper dive report is what are the appropriate benchmarking areas? So some folks, we heard that, the state is the most important benchmark. Others, it might be the U.S. It seems like for a lot of the ag folks, they were actually interested in what other states were doing in terms of like economic ag output. So do we need to be flexible in allowing folks to choose that baseline, or is there a universal baseline that we can set for different topic areas?
I think it needs to be flexible.
Yeah.
Yeah.
Because everybody's going to have a different benchmark.
Yeah. And that may change from one time to the next, depending on what their need is.
Right, what the context is.
Yeah.
One of the other things that we want to make sure you're on board with is and Melissa said this, but we have the concept, as you recall, we were talking last time about the concept of a CES report or something that would help them that was fairly detailed. Based on the feedback from the field, we heard that, as Melissa said, there's really a need for a much briefer report, maybe a 1 or 2 page type thing that is friendly and approachable with infographics and so on, and then maybe that deeper dive report. I want to make sure you were on board, or that the folks on this impact team are on board with that approach as well. And an example of this would be what we've been doing several years. Michael's been heading this up with University of Missouri Impact on the State of Missouri type of report. And you can see this is a 2-pager. It stacks a lot of information up fairly densely, but has some friendly approachable graphics and really gives you a snapshot sort of thing without going to that great depth of tables and maps and sources and all of that.
So if I'm a county council person, my benchmark though is going to be what I know about my community, my county, my surrounding counties. So I'll be interpreting all those numbers, all these numbers from that perspective. And then it's always like, well, I didn't know that. You know, you're always wanting that type of response to then dive deeper. So if they look at all these numbers and they say, I already knew all that, then they're not going to dive deeper and they're not going to come back. So did that come back? Did that come up in the feedback or in the focus groups or anything? Or maybe that's just something that you would do with, so on the dive deeper, is that again a web report or?
Yes.
We were imagining it would be a web-based report, more like our interactive reporting system now, but you know, with those, you do have the ability to export as a PDF or as a Word document, so to be used in a variety of ways as an output.
So would you have access then to web analytics to find out what people are then clicking on? So they read your 2-pager, and then you can then see where they start clicking.
Yeah.
Right. So the 2-pager would be a little more static, less or no choice probably on what is the content are. But it's formatted a little bit more friendly and it's something you can hand out in the elevator to somebody or you know, that type of thing.
Yeah. But then see what they do after they read it.
Right, exactly.
Where do they start clicking?
Or
where do they not click? And we think, gosh, why aren't they clicking there?
Yeah, if we put a big old click here button on it, they're not touching it.
Click here for more. That's a good, it's an interesting concept, and I'm trying to think about like how else we can capture that. And that hasn't been a concern in our focus groups yet, and I imagine because we don't have something to show people to say, here's what we have, weigh in. You know, this infographic will be something that's new, and this skinny report will be something that's new.
I think that's really important. I know we tried to do this with community comments in the early days, and Jamie may know more about it, but it's what is the offline interaction? How did our virtual space inform the face-to-face and the offline side? I think we really should think through that more. It's just, so what happened? And that gets more in the monitoring, evaluation, that we're going to be getting into more.
And then the second place it would show up would be like in the offline would be in the actual county council meeting. And they say, I found this information at, and it was something I didn't know before.
So. So we want our branding at the top and all of that.
Well, you got to make it really simple for the specialists or the county engagement specialists to just kind of mark, was it useful, is it valuable, just a ranking thing to start out, and then an area for notes. People are going to be very different in terms of the amount of time that they spend.
And how they disseminate the information as well. You know, somebody yesterday, or both groups yesterday, kind of talked about having the, you know, skinny infographic type report in the offices themselves and just saying, you know, here's information that we have, this is our public view into basic information about this county.
So kind of as a brochure.
Right, exactly, yeah. That's right, maybe.
have a feeling if I'm in a county, and I'm maybe just speaking for myself, but if I pull up something for my county, I want to see like what everybody else is doing around me. So I want to look at those counties around me too. So I can see where that would be kind of handy, because you could just pick any county and just
Right.
spit out a report, just have it right next to each other, right? So
And like kind of Dale and Angela were talking about having that flexible benchmarking,
mhm.
right? Like, do you want to compare against the state? Is that more important?
Yeah.
Or if you're in St. Louis, do you want to compare against KC?
Yeah.
Kind of thing.
And maybe that was kind of your step into the data to see like, maybe you don't know, or you don't know what's going on in your county particularly, but you see that there's a huge discrepancy between you and the county next to you. Maybe that's where you say, that's where I want to dig into this deeper and see why that is.
But I think our challenge, though, on this 1 or 2 page simple report is going to be determining what's in and what's out, because we have a lot more we want to put in than we have space.
Yeah, and for example, we looked yesterday, or one of the folks at our meetings was looking yesterday at examples of 2-page reports. And it's very difficult to find even something 2 pages that spans more than just one topic, especially if we're talking about infographic type reports where you have a lot of, visual, pleasing things to take up room. Our current impact sheets are very information dense, and we could probably do a little better on making those.
We've heard actually in our field studies, we've heard people come back with their district data sheets and say, oh, I didn't know that, because there's always a field that they're not into. Like, they're not into health. I didn't know this much money is spent by the zoo or is captured by the zoo impactfully.
I suggest with the 2 pagers, it's not around the impact area, but each segment: agriculture 2-pager, environment 2-pager, health 2-pager, safety 2-pager.
Yeah, the challenge there is you want something that's
More comprehensive.
one pile of paper sitting on the corner of the counter there rather than 4 and that type of thing.
So
You want something really quick and simple.
That accommodates all 4
that has, it says 1 or 2 things about each one. So that was the concept.
And one
Yeah,
idea,
Well, I didn't realize it was just for all
Yeah.
4.
Yeah.
One idea yesterday was framing it not in terms of impact areas, but because All Things Missouri is primarily an extension product, in terms of the grand challenges that extension has posed. So I think the healthy economy,
3,
the
education.
3, right, 3 grand challenges.
Health education.
Health, education, and economy, right?
I like that.
Yeah.
Yeah, maybe that's a better organization.
And then we'd have some
But we want
data from each
you to
impact
report
team
that data.
contributing. But the framing would be in terms of those 3 areas. How does the team feel about that? And folks on the phone, any thoughts?
And so what you're talking about, that's what would be on the 2-pager.
Right,
Yeah.
right.
Those 3, because I kind of like the idea of one for each of the major areas.
Yeah, and I mean, I think that's something we could also propose for our scope, an infographic for each infographic type report for each area too. But maybe our strategy would be to have the grand challenges reports as distributable, but you could also develop one of these other impact area specific reports for other uses.
I think we could do it over the course of the year. I know that Blake talks about templates and starting to build templates.
Yeah.
Based on the core, like our district data sheet stuff, is really doing one for extension, one for the hospital, etc. And that's down the road, but this is similar. I don't think a 2-pager around each of the specific areas, ag, health, etc., is going to be as valuable on the front end. If we look at toward the end, near the summit, as after we start collecting a lot of state level data and really having that unique flavor to it rather than just national secondary source, can be really powerful.
Agree.
What about, the phone people? Did they ever chime in? Hi, phone people. Are you muted?
No,
They may be as well.
Hi, this is Linnell from School Health Professions, and yesterday in class we had Rebecca Roselet come from the Boone County Health Department, and they are in the midst of doing their community assessment, and so are grappling with a lot of the same things that we're talking about here today of what to share and how to prioritize. And the health department had their ideas based on data having to do with STD rates and disparities among breast cancer mortality and breastfeeding rates and things like that. But then, and they had a lot of data to support that, but then they talked to the community, and what emerged from those focus groups were completely different priorities involving safe homes and neighborhoods and basic needs met and access to dental and medical care and things like that. So I think it's the data is really important, but also having your finger on the pulse of what the community thinks is important is really good too. And so maybe some of the data sharing could emerge from interactions with key people in the community and getting a feel for what community members think are really important, and then targeting the data based on what community members feel is a priority, and then sort of moving in that direction. I mean, that's one model, and it's nice because you have sort of a built-in buy-in from the start from the community you're serving.
And so are you talking about that the sheets would be different for each county based on the community in that county?
Yeah. So, you know, what is one community's priority might be completely different for another community. So, it's challenging because Rebecca repeatedly talked about how if it was her choice, she would have focused on these other things, but she's had to put her own biases aside and focus on what the community is telling her is their priority.
I think that's a great concept. I want to kind of frame this what's on the screen is community council report, but basically that 2-pager as maybe something that's going to be rather simple and brief. And I think we would look to the full reporting tools, that longer report, as the great opportunity to generate unique reports for each community that can be tailored to, self-define what the community is, self-define what's important. I know I'm skipping ahead a little bit here, but one of the other concepts that was brought up by the folks in the field is basically a drag and drop type of report, where it's not necessarily a canned set of indicators that you have in each report, but just like you were talking about on the phone here, that each community can then tailor it to exactly what they're needing. And that's really designed more for that full-fledged reporting tool rather than this infographic type reporting tool within the approach we've heard from the larger extension group out there.
And that's not to say that the customized reports, the drag and drop, as we're calling it, wouldn't be able to include more visually appealing things. Our quote full reports online right now are very table heavy, but we've talked about with drag and drop approach, maybe just pulling in a dial or just pulling in a chart for different indicators. And within each county, again, kind of getting ahead of ourselves here, we have the ability to save that report profile for printing purposes or for sharing, etc. So I think we could meet the spirit of that, being in tune with the community's needs. I think we just need to kind of strategically think about how to incorporate that type of feedback into our extension folks kind of daily into their routine as they're getting that feedback to develop that report.
And being aware of the audience too. Yes, if we do need more tailored reports that are simpler, that drag and drop needs to have an infographic or like a 2-pager it could spit out at the beginning to say, here's something a little simpler and more visually appealing.
Right.
So, I mean, decision-making though is, I think would also be a key driver. So if you had, going back to the county council type of mindset, so let's say a county, and I like, Linnell, that's an excellent point because that's, I mean, starting with the needs of the constituents in that county. So then you're on the county council and you're a decision maker and you have decision maker over revenues to spend to address these issues. So getting back to the concept of how does my county compare to other counties, I'm thinking of those county councils have, the revenues they have access to are, you know, whatever state appropriations, county funds, but there's also community development block grant funds are available.
Right.
And so you're looking at what resources do we have in terms of money to address these issues. And I think that would help. I mean, that's going to be on the deeper dive, but again, on the two-pager, can you give them some sense of here are the issues in your county, but here are some potential resources. And then it's like, oh, then we can dive deep. But I hear you. I mean, we know as researchers that morbidity and mortality predict things 5 to 10 years out, but I don't think that's where the person on the street is thinking. I mean,
No.
they're thinking of,
No, I'm thinking about that because of what I do.
I know. And I think we can help guide those conversations once we get folks to the table. But I think right now we're just trying to get them to the table. And what
The
gets them
average
to the
person
table,
doesn't want to know when they're
is-
going to die.
you know, is a job. They don't. They're in denial. They don't want to
I
think
agree.
about that.
So am I.
And if we prevent it, they don't even know what's been prevented for them. So, but if we can get a job, you know, if we can help with housing and transportation, basic health care, that'll get them to the table, and then we can start having a conversation with them. But give the county council something that they can have actionable stuff to do with. What can I do with this besides just say, oh, I know how bad it is?
But I think that just the whole concepts of safety and security are really important to include in our public county council report as well. Because you're right, those come up a lot. I mean, just in Columbia, in our communities plan, I know that those are what the community, what our community has identified as primary needs. So,
I like the idea of resources.
right,
These are the problems. Here are potential solutions.
right.
That's in your database. 10,000 layers, right?
2012 now, yeah.
There's data out there on, you know, what types of federal grant funding is available for different,
I went to McCaskill did a town hall 2 years ago. I don't know if you all went there, and it was about CDBG funding, state, federal, local funding. And there were a lot of people there from all over the state who didn't know what other counties were doing. And they're like, I didn't know you were drawing down this money, you know, that type of thing. We have that issue in our county as well. So it's like, and it's very uneven in terms of not jumping ahead, but to the jurisdictions and things. And it's not all the same.
No, it's
So
not.
you have some state legislators who are smart and savvy around, and the voluntary action centers know how to work with their state rep to pull those monies down, and other counties don't.
In the interest of time, we should probably talk about starter maps a little bit here.
Yeah. So yesterday we had talked about the starter maps that we presented that are on the All Things Missouri homepage, and just sort of an introduction. And originally we had kind of scoped those out as, okay, here's, you know, several in each impact area, our best guess, and a way to lead people into the map room for that deeper dive. But yesterday, after talking with Ag and Environment Impact Group and Business and Community Impact Group, they had some really great ideas around thematic starter maps, sort of for the same purpose, but you know, they felt like, okay, especially Ag and Environment, you can't really put, you know, one agriculture map, because agriculture means something different to everybody. So they had a suggestion about, let's ask questions and have people sort of get into those starter maps that way. And so, you know, a few of the questions, how is our population changing? And that could be anything from, you know, morbidity, mortality, and migration and workforce, you know, all these different things, and where are people working, just basic questions to get people into the map. So what, you know, we're proposing for this group is kind of the same thing, like what basic questions can be answered.
We can bring up the example of All Things Missouri. So on this, we might have as a header for each one of the maps, a question, you know, what is, you know, average life expectancy, or what's mortality?
What is land use in my
A basic
area?
question above each one of these maps that would lead them into thinking, oh, I'm going to be able to use this map to discover some information that's pertinent to that question. And it gets them to thinking the right way, well, how can I use other data to answer other questions that I have? And that's one of the whole reasons for the starter maps, is to provide that introduction, get people to not be afraid to jump into data, to jump into tools that use the data. We've experienced some of the people who say, I'm afraid I was going to mess something up in here, you know. And so we're trying to have a user-friendly approach to that. So back to Melissa's question here, if we're going to be doing some starter maps with that type of approach, what would be the types of questions and data you would want to highlight in 1 or 2 or 3 basic maps? And given that the maps can have more than one data set in them, but what would be the topic areas that you'd want to cover within this impact team?
So the 2 that we have up right now, we have a map layer around substance abuse. It's primarily around opioid prescriptions by zip code. And then we have a youth mental health starter map with I think homeless youth by school districts, mental health treatment centers, and ACEs, adverse childhood experience scores. So those are just 2 that we kind of threw up there based on data where we thought it would be kind of interesting, and you know, we've heard that these are key issues. Are there other key issues, or what are the questions that we want to drive people to the map to start to explore?
Well, before we get to the question that I have is, who's the audience? In other words, who's going to be in looking at this? Is it going to be healthcare providers? Is it going to be the local public? Is it going to be teachers? That kind of.
Yeah, I think all of the above. There's not I guess I would say there's not as, we're not being as narrow in our scope for the audience here. It's more in terms of getting folks acquainted with the ability to use maps to answer questions. And that could be, you know, again, it could be extension folks who are working with community members who want to be able to make a map to show to their constituents. It could be school district personnel who want to know what are the treatment options in Missouri for youth with mental health issues. So yeah, I think the audience is our intended audience is wider here. But did other folks have?
No, that's right. It's an open audience.
Yeah.
Okay. Well,
Does that leave your question then?
Say that again?
What was your question then?
Well, my question was who's the audience, but then I have just a thought about it. You said rather than just a header, have a question. My worry with the question is that it may narrow thinking. That I almost like the idea of just a general header, and then let people get in and, at least that's what I do, get in and poke around. Because I usually let the question guide me where I want to go, and I don't know how other users, maybe they would like questions, I don't know, but for me it would kind of narrow my thinking. You know, that isn't my question. Is that going to be relevant? I really just see a header.
Yeah, I can see that. I think the discussion yesterday was more like along the lines of let's see if we can use a question to make it more attractive to people to even click on.
And I think it was around providing some interpretation for what's being displayed on the map. So, you know, right now it just says substance abuse starter map. What is that telling me? We don't want to, as CARES, get into the, I guess, business model of providing these, you know, large narrative stories. We tried doing that. We're not the content experts, but having a few just 3 sentences of interpretation, or what can you do with this data can kind of help people see how maps can be relevant.
Right.
And
and I
maybe
think
it's not a
that's-
question, maybe we're thinking more like a headline.
Right.
Yeah, and we
Um,
have 2 sentences up there now, but they're not, I don't think, they
Where-
don't
where's
get
it?
to interpretation.
Where are the two sentences?
On the back.
Yeah, right here, on the introduction.
Started.
Yeah, so it's kind of a description rather than
Rather than
an
a question.
interpretation.
Well,
And it doesn't have to be, maybe question isn't the
What
right.
we're looking for though is to get somebody to say, oh, I can use this, I can take some action, or I know I can do something here.
And something that we've learned in talking with people is they're just kind of intimidated to even look at the map.
yeah.
I mean,
So on the substance abuse, I mean, different people looking at, so the treatment facilities would be helpful for children and youth providers and referrers to know that is there anything in my community? Mortality rates, let me skip over that. Total number of prescriptions like drug claims, I think if I were in law enforcement, that would be kind of interesting because I might have my suspicions about who people, I mean, how my personnel are deployed across the county relative to, how granular is that? That's by zip code,
It's
right?
zip code data on, I think it's CMS claims.
Could you do a
Medicare,
rural
Medicaid.
place besides St. Louis? Because, I mean, not that
Sure.
I'm biased against St. Louis, but
any suggestions?
Any county?
let's do Randolph. I mean, it's close enough that we kind of know Moberly's there and some other places.
I would zoom out one level. What is it? Yeah. Most of the counties missing, it looks like there's just 2 zip codes
And
with
you
the
can go,
information.
you could do the data types, you got total, the percentage.
I do like the idea of the description rather than the question.
Yeah.
So, I mean, so that part of the county is awfully purple compared to other parts of the county that aren't. And, you know,
Yeah, so
why?
I mean, I guess it kind of gets that, you can lead people to interpret this as what areas within my community are most vulnerable to X, Y, Z. You know, if you put in layers on of premature death, you know, where is that an issue? We're talking about disparity and inequality in communities. Some interpretation of, you know, this tells you where the populations are where you need to intervene, you know, if you're a clinician, but there's going to be, like you said, depending on the audience and the user, different interpretations of what that data means and how it's relevant.
So how many, like how many school districts, is that just like one school district in Randolph County? Is it multiple school districts? Is it, from an ag perspective, I mean, why is that part of the county different than right next to that part of the county? In terms of, are people, at work, I mean, a workforce question, is that how people are supporting themselves as opposed to other workforce issues? I mean, it just begs a lot of questions that I think people who live in that county would like, why is it so different, you know, that particular area in that county?
Right.
And then again, if all the treatment providers are right there in Moberly and there's nothing elsewhere. And then what are those natural boundaries there? I assume some are roads, but others are squiggly, so is there.
Those are zip code boundaries on the map.
But is that zip code aligned with a creek or
Oh, yeah.
a river
A
or?
variety of things. And technically, there's no such thing as a zip code boundary. Those are made up. Zip
Right.
codes are actually delivery routes. So
Yeah.
these are lines between the ends of delivery
Those are
routes.
good questions, though. I mean, I wonder, you know, we want to encourage that exploration, and how do we, I mean, maybe it's starter map to starter map, but how do we prompt those sorts of questions so people are looking at, like, I know my county, or, you know, I have no idea where Moberly is, you know, but somebody who's from this area would say, okay, this makes sense to me because, and then maybe they can explore another map layer or overlay something else or bring in their own personal local knowledge. How do we encourage that?
Right, like maybe they have a hypothesis of why that rate is high there and could search for another data layer to add. Like maybe there's a senior home there, or there's a cancer treatment center there, or who knows.
Can you click on that dark purple one? Bring up the info.
And when I see different colors like that, that actually makes me want to click on them to figure out what the differences
Yeah.
are.
We don't include the post office name for some reason.
And why is that little bump there?
This one.
Yeah, why is that there?
That's how Census Bureau defined the geography.
Yeah. But so are there other jurisdictions besides the code for that?
For that
For that
particular
layer?
data layer,
Looks
county and, the prescriber.
So there's no, you don't have census tract for that level?
Mhm.
Not that data.
Not yet. And so when you're saying, what to make available in terms of view, you're thinking of these 10,000 layers, what do we put in
And
the
starter map.
in the stop down and the drop down?
Yeah, and it should be things that are pertinent to the topic.
Good.
Oh, there we
Under-
go.
under-
Yeah, you need to turn off your other point layers.
Underneath, or it's the transparency, actually.
Yeah, there, okay, I see. Yeah, that's a
The
good point,
providers
though.
are all over random overlay, yet
We don't,
things are really.
right, but we don't do anything to prompt those kinds of questions. We just say, here's a map, and then full stop. And
Yeah.
we're not, I mean, we had a conversation this morning about, we've done field studies and people are like, yeah, I don't know, data, that seems great, but, people who don't have a background in it need a friendlier approach to getting into things like this. Like, you can add data to a map. What does that mean? What can we encourage in these starter maps?
Mm-hmm.
What sort of further questions and, I kind of like that approach personally, like having a couple of statements around like, this is what you're going to see, but then, encouraging people. And we sort of talked about that in one of the groups yesterday, having 3 questions maybe that they could answer with this map, but maybe we could turn that around and say, what questions should you be asking to look into this information further?
Or, but extension staff could be trained to do that.
Right.
So
Yeah.
in vivo in a meeting, they could be
Mhm.
saying, somebody like me might, why is that bump there in the extension staff person? Then having some familiarity with the layers, how to work with the transparencies can then do
Right.
that. I don't think the John Q. Public will
Mhm.
be inclined to want to do that.
Yeah.
So much of what we're thinking about now is not public, but what's the value add that extension really brings to the table?
Maybe,
How to navigate this would be huge.
right, well, how to navigate it, but even those fundamental, like, how to use data questions.
Mhm.
I mean, that's something that is still like pretty scary to a lot of people in extension, at least that we've talked with.
Oh,
So my
that's
question,
okay.
Right, but it's one thing that we need to be conscious of.
Yeah,
like,
that's what
okay,
training is about.
Right, right.
so this exercise, we've been going through this for several months.
Yeah.
And it's really extension centric, but researchers are part of the equation is what might we do around the complexity that researchers could get and tap into, and also the data they can extract. Maybe there's,
Yeah.
that we need to explore that more.
Well, I mean, and I talked about this at the summit. My questions need to come from the end user. So you're in a county council
Right.
meeting, the extension
Right.
staff has gone through, they have figured out why that part of the county is darker than the other part of the county. They figured out why the treatment providers are there. They know why the opioid prescriptions are there.
Mhm.
But then they have these like 3 questions that they are having a hard time grapple with. And the extension person is like, we looked at this layer, we looked at that layer, we couldn't figure out. Then we just bring up Dale and say, Dale, what do you think? And then we go from there. But it has to be their question coming to us.
And I think by that point, we're beyond the purpose of the starter map.
Right. We're diving deeper at that
Right.
point. But we've achieved so the end goal is actually to not answer questions is to generate more questions.
Mhm.
Right, really the goal of starter map is to start people out.
Yeah.
And you start people down a path. And that's the goal of these. And so we're looking for what data and topic areas should we focus on for these starter maps that we think will be attractive to the most people. They'll say, oh, I'm interested in that.
Yeah.
Let me click on this. And also will be not so in-depth that we lose them once they get in there because it's some sort of, quartile analysis result or something like that,
Yeah.
that they can't understand. We're looking for the data to be meaningful to them.
Yeah, and I mean, maybe we should try to tie these starter maps in with what comes out of the, what kind of percolates to the top of our two-pager report. You
Oh,
know,
that's a great
so
idea.
that
That's a
we've
real
got
good idea.
That's really good.
overview here, but you know, learn more or go deeper or more granular with the starter map.
And also, just on the extension community needs assessments, those are the,
Yeah.
what's the homepage again? That's like substance abuse, that's huge,
Mhm.
because that cuts across all kinds, it's a workforce issue, all kinds of,
Yeah, so that's a great topic area right there.
yeah.
We
Business
also did
startup.
mental health.
Mhm.
It's an important topic.
Yeah.
And
So I
that's
guess
the only two in the,
the questions are, you know, what do we as CARES curate and point and drive people to? And then again, kind of skipping forward a little bit, we've also talked about the idea of specialists being able to develop their own starter maps and with the data that's relevant to them and save those within their profile or even push them public to a mass gallery type approach.
that's down in our next section of discussion.
Yeah.
Do the
So,
web layers show up in your analytics, web analytics, so you know what layers people are adding?
Yes, in the back end, yeah. Yep.
All right,
yeah, and the number of times they're accessed.
Yeah.
that
Okay.
kind of thing.
all right.
Right now, I don't think we have, are we filtering out our internal university IP address?
At least on the Google Analytics side. I assume Yen is too, but.
Yeah, we were doing that before with users with Community Commons, but since we don't have users right now, I don't know how that's being handled.
We better, yeah.
Yeah.
So yeah, there's just two starter maps we got right now, one around mental health, one around the substance abuse. Didn't know if there's any other important areas, or maybe one of these two is not important, maybe you'd rather have something else. I don't know.
Why not business and workforce?
Yeah, I agree.
Workforce.
Something related to the economy, getting people to
Yeah.
work.
I over to the community as well. So that's fine.
I'd like to see a map, starter maps regarding reproductive health. If that,
Very well.
Reproductive health.
Reproductive.
Yes. That's great. And then I think also another easy one to do would be something around access to care that we could get granular at and actually have locations of providers as well.
in the chat, I listed the priorities of the state health department for the state, which are opioid crisis, behavioral services, particularly for veterans, access to care in rural Missouri, some Medicaid issues, and then maternal child health. So having maps that align with those priorities might be helpful, because I suspect that funding streams from the state will correspond to those topic areas.
That's great. Thanks for sending those our way.
So those will be possible.
Yeah.
Yeah.
Well, what I was thinking also is that if you had, just a broad topic health, and then under health would be mental health, adult youth, and then reproductive health,
We kind of talked
because
about
those
that.
are all different types of health, but then
Yeah.
health would be the big,
Yeah.
and then you could get providers.
Yeah, agriculture was a lot like that too. Where there's like ag and there's like all these subsets.
That could
Health
be-
is kind of the same way.
So like
Yeah.
the mass gallery aspect, that would be a good use for that. So we also talked about, a good kind of a segue into,
Speaking of health and mental health, do you have a layer for telehealth and mental health? Because that's taking
Yeah.
off, and so Medicaid
Yeah, I
provide,
think
it
so.
should be, it's part of the it'll be part of the Medicaid, data set
Yeah.
in terms of whether how many
they'll have
providers.
actually claims data for how many
Mhm.
folks are using it. you
Right.
think? Okay.
Yeah,
I'll
it'll
look
be in
into
there.
that.
And I was
That's great.
on another webinar for an ECHO webinar about telemental health, and there's wide disparity across the state in terms of like regional health centers that have mental health components that are using telehealth and telemental health. And the question was, why is there such disparity? And it was related, primarily came down to the administrators for those health centers were open and receptive to using it. So there wasn't any other reason. I mean, the state has it authorized statewide, and it was just a variance due to local
People.
Perception,
and you can fix that.
Right.
So
You
is
know.
claims data really the best place to get hold of that, or is there a better, more current source just from Missouri?
Well, I mean, claims data would be ideal because you would know who's actually utilizing it. But there's also, they should also have who's licensed to provide
Okay.
telehealth.
We
and telemental
get telehealth data for the distribution.
I know, for Missouri,
But it's, yeah, by state, but
and it's from
somebody in the,
MU,
that's true, yeah.
all, that's true.
And the kind of thing you're talking about comes under the heading of providers,
providers.
because there are all
Yeah.
kinds of.
So we have issues over here. What are the possible solutions?
Right,
You're
right,
looking
yeah,
at
it
it,
goes back to
you look at it
solutions
from a
and
county
providers
council
versus
perspective. Why do these other counties have access to telemental health and we don't? When we have all these opioid issues.
Good framing.
I can go run amok with you. That's what you want them to do. You want them to be clicking everywhere. Saying,
Right,
"Oh, come
right.
what's going on?" And the extension staff are like, why are you making us work so hard? And then we take that, we put it on Marshall's desk, and we say, Marshall, we found a need to address.
We have value.
We have value. We want to make an impact. We want to make a difference. So, anyway, I'm sorry.
No, that's great. No, and that's really great framing that I think we need to consider in these starter maps. And I'm not a data person, that's my caveat, but, problems are easy to identify, but also what are some potential solutions?
Just so that, I'm wondering too, on the starter maps, I know that we tag those by a specific impact area. Maybe we just get rid of that also. I mean, as we're finding out, they're pretty broad. Anybody can check these things out. Maybe that kind of like narrows people's ideas to think, oh, well, I'm this in the community.
Right.
This
Especially
is
with
tagged as this. I better look at this as opposed to, oh, here's something else. I mean, this is a.
Right. I mean, workforce would be a much more valuable tag than,
Yeah.
yes, community,
Okay.
for something like that. So kind of on that, we sort of came to some conclusions, and I think Chris mentioned them, we've sort of been talking about them, but having extension folks really start curating what is important to them. So although right now we might not be able to build that county council report specific to each county, having the CES go in and say, well, this is what's important in my county, and being able to save and share that behind the paw print, as well as bring in additional data that the public wouldn't see. So that's sort of the concept behind the drag and drop report. And similarly with the map gallery, having extension folks be able to have on the health page, here's the top rated or however we end up curating, but somebody in extension has made a mental health map that's really powerful for a lot of users. Being able to share that at least behind a paw print, if not publicly as well, and making those decisions probably as we kind of get into this and understand the landscape and the need and our users a little better.
So in our discussions with folks around the state, we kind of came up with a few different needs that would be resolved by having a restricted use area, either through a paw print or a subscription that we've got listed here. But basically the needs are, one, they want to have an area where extension folks can kind of communicate with each other and share data and work as a behind the scenes type of place. Another is, yes, have an area where you can save things and share things from, like what we're talking about, and have some of that. Kind of the third area for this would be to use this restricted use area as an opportunity for generating revenue in terms of supporting the activities, supporting extension, and et cetera, through subscriptions. And then finally, the area serves as maybe the opportunity for subscription or extension to have access to more data and tools that they can use in their role in the counties that maybe the public don't have full access to the information, whether it's sensitive data or just other tools that are kept for extension folks, or maybe more well-trained in how to use that tool or how to interpret that data set.
Right.
And we're more reluctant to have that more generally accessible. So that's kind of the concept of the behind the paw print area, which should also be / subscriptions, because we're thinking there'd be certain things that we would offer out to the public, but would be in fact a subscription product. So what do you think of that concept there? I think our other 2 impact teams yesterday were very favorable towards that type of approach. And so it's a very necessary thing.
Yeah, and we're saying extension now. I mean, we're we're talking about for different things. You know, what's the difference between extension users and other university research uses, and what of these tools that we're talking about putting behind a paw print or for subscription are extension versus researchers, especially talking about data upload. I know that came up as a research need as well as a need for potentially for field folks.
I think the subscription idea, maybe hit and miss. So getting into this kind of thing, or if I had a subscription, it may be something that I need now, but I may not need it for another 6 months or another year until I'm working on this other project. So the subscription, at least for me, I think I would, kind of depends on how expensive it is, but I'm not sure, because I've had other things that I'll get it and then, okay, I'm done, and then I don't use it again for another year or 2, and then I have to go back and get another subscription. And then I always wonder, is this really worth it?
One of the tools we're thinking of standing up as an early subscription model is the AgSite tool. And we had initially envisioned that as yes, buy into that for a year or something like that. And it was suggested yesterday that we don't do that we turn it around to be like a more of a per report or per set of reports. So you get, 30 reports for this dollar amount, whatever. That type of thing. So it does tie the value more closely to the actual use on those to get to one of your issues on that. So you're exactly right. It's going to be hit or miss, and I think it's going to have to be around value add tools and interactions. And it may be things that are tied to courses, for example, if you're teaching some sort of extension course or going out and training people that you want these things involved in you would use this as part of being able to help you sell this course. Hey, come take my course, and you'll also get a year's worth of access to these data sets and through the All Things Missouri, that type of thing. So you're looking to not necessarily as always a standalone type product. It can be combined with other ways of doing extension activities.
Chris, do you think it's worth discussing our engagement network subscription, the tools we're talking about moving to subscription there, as they relate to health, and whether or not those should be available through All Things Missouri as subscription? I'm thinking vulnerable population footprint and the small area estimate.
I think it's going to be important. When I was meeting with Kyle yesterday, it's around that All Things product line. So we have All Things Missouri, but it's going to be for other extension states. Building a cart in Magento for each state. In other words, a lot of stuff for extensions across the country, it's a one-way flow. Oh, here's information. You've got to pay $25,000 to be a member at the extension. But there's no opportunity to generate revenue for that state. Yep. So I think really having the different storefronts for each state, and there'll be overlap, where we'll be doing it on the engagement network around the vulnerable population, but we'll offer that through each state as well. Is that what you're asking?
That was what I was asking. So we are talking about offering the vulnerable population footprint reporting tool as something that would be behind a paw print for all things and available as a subscription.
That's yes. So again, literally, it was yesterday we had the meeting. So this is news. We've got to make sure we've got the template set up for the CARES Engagement Network, how we offer our subscriptions, and that we just have that same template available for each state at the state level, because extensions will really like
being able
to generate the revenue.
Right.
So what Andrew was talking about are a couple other tools that we already have we're going to be putting behind subscription paywalls on this. It could be brought into the All Things Missouri. They relate to health, and could be something that we would offer behind this paw print. We wouldn't be charging, of course, the extension folks on campus. It would just be restricted access to them. But that it could be offered out to the public as well. So you would have that sort of situation where you could be an extension personnel, and because you have access to it, you could be accessing it with somebody you're working with and give them that information and all that, and that's just fine. But if they want to access it themselves, outside of working with you, then they come in through a subscription. Does that make sense?
Yeah.
You know, as we think through this, is even for extension, they should subscribe, bear with me, they should subscribe, but they have that code. That, what was the word that code is? The group code?
It's a discount
A
group
discount code.
Yeah.
So we're able to track what they're doing through a subscription process. They don't have to pay for it, but it's still a way to check, you know, what they're actually doing and how they're doing it. Maybe we don't need that, maybe we do.
Well, with web analytics, when
Right,
you know,
We'll be
Yeah.
tracking.
We'll be able to track it because people will have a login, right, either
Well,
way,
But
right?
Chris has a point,
yeah, I
because
agree.
we will have the additional Magento analytics
Yeah,
if we do it that way through Nexus.
Yeah, we'd have it regardless if they have to log in on Magento.
Well, that's true. That's going to
Yeah.
log in through one.
Right. Yeah. So we'll have that.
We'll think
But
yeah,
guys,
that would be more
we're all
effective.
thinking this as we go too,
Right,
so,
yeah.
this is, any thoughts based on?
Yeah, any thoughts on the whole concept of subscription paw print?
Is this still public, is this all public access data that would be behind the paw print? That would be?
No, behind this paw print, you can see it in the list here, you can include data that you've uploaded yourself. And so you would have access to your data that you've uploaded. Or perhaps we're talking about the ability to share it out to a selected set of extension folks if you want to share it with your team. And so, no, it would not be public data necessarily. It would be protected data also. And that's the mechanism that would allow us to have that protected data up there. Now we still got to be sensitive to FERPA and HIPAA issues. And if we need to head down those roads, we'll have to do some infrastructure things behind the scenes to comply with those regulations. And then, of course, there will have to be other protections and training of people that would upload that data. So, but those are all possibilities.
And with that question, do we have a good sense of what would be behind the paw print?
well, in terms of the report, if we're using the engagement network model, so right now we're talking about having a CES report and our deeper dive reports for each of the impact areas, as well as drag and drop reports. With the engagement network model, the free and public access, no login required versions of those reports would let you pick one, I think just a single county right now, right? Our subscription reports will be allowing you to draw custom areas that you'd like to define, pick multiple counties, pick from zip codes or census tracts, really get that local level
I love the drawing
report data.
idea.
Yeah. So that's for our engagement network model, what's going behind subscription versus open to the public. We haven't really had that conversation about All Things Missouri, so it's kind of the first time we're talking about it here.
Angela, this is Linnell. So when you get into rural counties and you start drilling down into this stuff, you'll find that a lot of data, you hit a threshold where you're getting into really small numbers, and you, as you know, very well know, you run into confidentiality issues. So I'm wondering if with this subscription, would a training happen so that someone out there might not inadvertently compromise someone's confidentiality with their ability to get down into smaller numbers?
Right. Yeah, that's a great point. So I think that we as CARES, with what we are adding to our reports, will be sensitive to confidentiality issues. We're not allowing folks to access right now any data that's being aggregated and suppressed on the fly. I'd say that what we have is, our suppression limits are already set. So we're not going to have data for any counties where it's less than 10 numerator or something like that. But if we do get into this realm of acquiring a lot of primary data and doing that suppression on our end, that could be an issue.
Right.
And when we're talking about allowing users to upload data, that will definitely be an issue. We have talked about before allowing folks to use the upload tool, making them go through a quick like Canvas training course on data governance guidelines and FERPA and things like that.
And then getting some sort of curation process if we have to, and saying, great, you've uploaded your data, you can see it, but before you share it out to anybody, somebody, needs to be on the hook to make sure, right, it's appropriate and not PII. Right.
Yes, we had, that's what I was gonna bring up, is we had that discussion, especially before it's made public.
Right.
Or outside of extension.
Yeah.
That there needs to be a, extension sign off on that.
Right.
That data set. Does that make sense?
Mm-hmm. Yeah.
Okay, so you guys are volunteering
Oh,
to
yeah.
go review all that data?
Well, I mean, some
I
of
don't know
that,
about that.
I mean, some of the, just going back to the IRB guidelines, into the application and making sure it was compliant with the, because IRB asked for that as well.
And I don't know, where we would be with IRB and the existence of this data upload. We may want to independently approach IRB and get some feedback on issues like this.
Yeah.
Because we may have to put up guidelines for folks saying, either through training or written on the web, saying, look, if you're in the middle of a study, maybe you shouldn't be putting this data on here, or something like that.
The flip side of that coin, though, with NSF and broader impacts, is you've provided an easy mechanism for dissemination, and researchers are going to love you for that.
But by that point, your data's been vetted or reviewed.
Oh, yeah.
By the time you're ready for publication. So
And
I think
maybe,
we'd be safe at that point.
well, and maybe that is your decision point, is after it's been published and vetted, then you can make it public. Until that point, you can't make it public. So, and have all these other mechanisms on campus
Yeah, I think that's
handle that work for you.
kind of where we landed on yesterday in one of the meetings. Once it gets to that point, it's pretty safe to.
But it has to be public by federal law.
The other thing that we brought up yesterday tied to providing data into the system, if you're as an individual extension employee providing that data in, is that we've got to have some sort of tagging mechanism so that your data is discoverable if you are going to share it out beyond just yourself. So you got to go and know enough about, or at least have to have some guidance in the system that will guide you through the metadata process. You can say, okay, this was for this year, or the source or survey method, things like we talked about geographic tagging so that you know this is only data for Springfield, Missouri, or something like that. So we had several good discussions yesterday about that.
And you have a sandbox, right, that it would be uploaded to, and then curated at that point?
Well, yeah, that
we'll have
seems
to
to
work
be the emerging
through.
concept, is that it would be uploaded and held to you personally. It might be one of the simplest way until it's reviewed. The challenge would be is who's reviewing that? Is that background cares perhaps to review that, and then what's the volume of that data? If it's a million data sets, we're going to be challenged to get Chris Fulcher to go through all that data and sign off on it.
No, I would hand it back to extension.
Yeah, it maybe have to be a bigger,
And
broader
have,
audience.
and maybe start at the county or that regional extension, and then do regional extension, have them curate it, and then come to you all for some of the more meta data tags. And in that way, that'll be, by the time it gets to you, there'll be at least 3 or 4 sets of eyes that have looked at it.
One of the challenges, or one of the things you don't want to do, though, is create a huge impediment between something that should be out to the public really easily.
Oh, so then you get a researcher on campus whose tenure and promotion is dependent
On checking off the data,
on making sure.
maybe the year-end bonus or something.
I get those emails on a weekly basis. What has happened with, why hasn't this been, I have my promotion coming up, and why isn't, so that'll take care of a lot of that.
There you are, okay, that sounds like it.
Tie it to the reviews.
Yeah.
And with promotion actually happening nowadays. There we go.
We heard that yesterday too, didn't we?
Yeah.
Yeah.
You review a better data sets, you get a promotion.
So you upload
No,
100 data
seriously,
sets.
it is, that's productivity.
Yeah.
Yeah, you've heard it from two people, it's true now.
Yeah,
There you go. And I knew nothing about the conversation yesterday, so there you go.
it's the truth.
It's the truth.
So I guess what we're discussing this area for is to make sure that we're covering the areas from this impact team's perspective that need to be covered in this paw print / subscription area. And wanted to hear if you do have any activities that could be put behind those two areas as well that you're already doing.
Just mean, not at this point, there may be something in the future.
Mm-hmm.
We're making some plans, but not at this moment.
Yeah, nothing you all haven't already talked about. Like, and we met a couple of months ago, Chris, with Kathy Preble, and she had that, data about sex trafficking. I mean, that's the kind of thing that we would want to, eventually make public, but
Right.
it would be behind a paw print for
Right.
quite a
And this
while.
was her data, stuff that she had collected?
Yeah, some primary data.
Cool.
Yeah. But,
And don't forget, there's other mechanisms to getting data into All Things Missouri. It doesn't only have to be through the uploads. We are constantly reviewing data sets and putting them in and so on. So they
So
can
we
work more
also,
directly if the data is more complicated.
we also have to think about what is All Things Missouri, keeping it simple and not trying to tack in too many different things, as opposed to what we want to do as a university. So we've got All Things Missouri, we've got the engagement portal, we've got the footprint tool, we've got all these components. The more we try to lump into an All Things framework, the more difficult it's going to be to help other states understand what they can do. So with, we talk about researchers or the colleague around the human trafficking. Is that more suited to a module in the CARES Engagement Network?
Sort of a standalone website.
A standalone website, but it can be reflected in All Things Missouri as an activity. So we have these activities going on, but what is core to All Things? And what is an activity that helps strengthen the All Things?
That you would link out to.
Yeah. So I think that's I think a great opportunity for the campus to have flexibility, so they're not constrained
and logged in.
in that. But with the paw print and what we develop with user roles, security, I think we need to be thinking of research in the campus as we build out all.
Yep. Well, shall we pause here for a quick break? Come back in 10 minutes or so, talk about priorities?
Yes,
Sounds
we have
good.
some
Any-
data questions after the break. So, yeah.
Any final thoughts from Linnell or Aaron on the phone?
Might pull up the chat too.
Nothing productive. It's going good so far. Very informative.
Good.
Great.
Yeah, thank you for sharing, and I really appreciated Chris's last point about putting some boundaries on this and not letting it get so huge that it's unwieldy. I think that's a really important point. So there's a lot of exciting possibilities here, so thank you.
Great.
So, how long?
Okay. We'll just take 10 minutes or so. Folks on the phone, we're going to mute you so you don't hear our background noise, and we'll convene again in 10 or so.
Right here.
Yeah.
For the folks on the phone, we're gonna start up here in a minute.
In other words, I'm aware that if they weren't available, I wouldn't use it.
Mm-hmm. Well, maybe they were purchased 2 years ago, and so
Right.
you gotta use them up. And deal with the plastic in your blood later.
Chris, do you mind shutting this? Thank you. Read my mind. So next we should talk about data sets. So Angela's going to pass out the data set you all have seen over email, which is what we've discussed here in the impact team.
There's two pages. Nope, they're yours.
The first staple set
No.
are the data lists themselves, as well as things that we've also heard from folks coming up to us in the summit, field studies, usability studies, training, other data that people are interested in collecting, and some of it might be redundant. And then the second page that Angela handed out is the jurisdictions. So other requests for jurisdictions. I think there's a few we heard yesterday that haven't been added to the list yet, but anyway, we'll first kind of talk about how we're planning to prioritize the data sets that are going to be in All Things Missouri. And then next we'll do a brief exercise to try to better understand what you all think is important and what you all think that the CESs or the public should see as important in at least the health and safety realm. And for folks on the phone, the documents that we're currently looking at are the things that Angela emailed both last week and Tuesday.
Right. I think there's a link to a Google Sheet where there's a list of data for the specific impact areas across the bottom, across the tabs, as well as a specific or separate tab for the jurisdiction that would be used potentially in the crosswalk tool or in the reporting tool.
Great. So data prioritization.
Yeah. So for the next phase of All Things Missouri, so building out the data for the specific impact areas, what we're asking folks to do, both here and or over email, is to kind of prioritize the data, that 3 data sets, we're saying 3, but list more than that or rank them, 1 to 5, something like that. The data sets that will be most useful to you and data sets that will be most useful to a new CES or the county commissioner or folks in that senior report. And just to give you some context on how we will then take that information and prioritize the data sets for All Things Missouri. So we're looking for, is the data going to be collected regularly? Is it available from the government or a trusted source? Because remember, we're talking about, for a lot of these data, displaying trends. That's a way to make the data most useful or interpretable. Is it free and is it easily accessible? If no, that doesn't mean that we're going to rule it out. It's just going to need to be kind of factored into the balance of, how many data sets can we acquire and, how relevant is that data, how important is it? Is the data specific to Missouri? That can be a pro or a con, because remember we're talking about potentially benchmarking to other areas, but if it's specific to Missouri, we might be able to get more granular, actually down to that zip code or school district level, the neighborhood level, whereas a lot of times, or more current. A lot of times the national data, 5-year lag, and it's only available for most populous counties or metro areas. What population is the data most likely to impact? So is it specific subpopulations? Is it vulnerable populations? Is it the total populations of the community? And then is it going to be useful by people in the impact area in the field? Is it actually going to help us make better decisions, or is it just, this is really interesting and I'd like to have it? And then the final consideration for us is someone already, are we already working with someone on acquiring this data for another project? So is it something that we're using for our work with clients on our national community health needs assessment? Is this something that we're using for our community action agencies, et cetera? So So those are kind of our considerations behind the scenes, but we don't really want that to limit what you all think is important. And to that end, you know, we're looking for the top 3, but if there are more than that that are going to be relevant, please don't hesitate to include those as well. So if you can mark on the list if they're already on there. If there's something that's not on the list, then you know, feel free to write it on the pads that are provided. And folks on the phone, if there's anything that's missing, if you could chat those in, that'd be great. And then I think, Linnell, I think the points about the priorities for the state health department are great feedback, and we'll definitely incorporate those in our prioritization as well.
So yeah, again, it's fine if it's already on the list. You can still mark that as one of your personal top data sets to have, or one of the top data sets that would be useful to others in extension. What we're looking for is to kind of prioritize this list.
And only choose 3?
Well, that's a target.
Close.
That's a target.
I think we had one person yesterday who stuck to the 3. She was very into that side. It was mostly around the 10 range.
10 mark, yeah.
Well, I think, I mean, have a lot of very distinct multiple perspectives on this as I'm thinking about it. Because, you know, getting back to the point raised earlier about morbidity and mortality, because those are really precursors to a lot of things that we know are going to happen down the road. I mean, you can absolutely predict. So the one that jumps out at me is like prenatal care. And people are like, what? Why prenatal care? But that is, if you have a lack of prenatal care in 2018, there are like a multitude of reasons that go into that are all social demographic. You know, it's not like somebody says, oh, I didn't know prenatal care was available. You know, everybody knows you need prenatal care. But if you don't have it and you show up at delivery, it's like a red flag. And all these other things would then flow from it.
Go ahead and mark that as a high priority one on your list.
I mean, it's a high priority for me as a researcher and as a professional social worker. John Q. Public isn't going to say, what's up with that? They're not going to know. But I'm, as an extension staff person, I would say, well, this is very significant for my community because.
So part of the reason we're doing this is because we don't always know what's important from the research standpoint or from the county specialist standpoint. So we want to make sure that we're capturing this information and make sure we prioritize it in our work plan.
And I mean, I think these are going to be priorities for our initial build, what comes out of these discussions, as well as what we've already heard from folks, both through our one-on-one sessions as well as in our other impact team sessions. But this will be a, kind of continuously evolving and dynamic process. We'll talk a little bit later about kind of how we're going to kind of solicit that continuous feedback throughout the next year as we develop. So don't feel like what we list here has to be the end point. Again, to Linnell's point on the phone about getting community feedback, we're going to need to be responsive as new issues emerge, both for extension, for communities, for the state. So this is just phase 1.
Right. It's never going to end.
So we'll give you a minute here to think about that.
And I just wanted to say that, what you're contributing to now is that lens that we're looking at through extension and all, but from a research standpoint, I think, Dale, I really, defer to you, is just how do we create the path where we build a stronger research dimension and maintain the integrity of what we want to build with the all things? Does that make sense? Because I know in the previous meeting, I know Sarah and some other people who are more research oriented, they want all the data. Extension wants only a little data. They want to be able to clearly communicate what they're doing, but the researchers really want to explore, and so it's a different thing.
Yeah. I think of it in terms of the end user, it's more like the dependent variable is, they want to know about their income and health status and all that kind of stuff. As a researcher, I want to know about all the independent variables leading to that dependent variable, and then we have a conversation that brings those things together. So,
Yeah, and at the same time, the extensions, like grant challenges, we're trying to move the needle on those different things, right? And there are different ways of tracking how we're improving the health of Missourians. So I think we'll definitely be responsive to having some data in there that responds to those points as well. We'll just spend a couple more minutes on jotting down those thoughts, and then I guess we'll move to the kind of our timeline and our strategies over the next year in terms of feedback, training, et cetera.
And don't be afraid to put down a big topic area too. I see one of the data lists from the field was Medicaid/Medicare. That's a lot of data.
Right.
But that's fine to put something like that.
is there anything about income other than poverty?
Certainly we have
Yeah.
access to a lot of it. It hasn't necessarily been listed on here, but there's a lot of income variables from a variety of sources, either the American Community Survey or BLS or something that we are planning to tie in.
Right, and so there are, we've just included in this set that's distributed what we've heard from our team around health and safety. We have a lot of data in our business and community report specific to income, but if there's something beyond what's listed here, definitely that'd be good to know as we're building out these topic area reports as well.
Don't forget the drag and drop reports. You'll have access to a full suite of data to
Yeah,
pull in.
we've got things
And
like,
to the mapping.
median, average household income, things around housing, like cost burdened households, like those paying more than 30% on housing costs.
Things like public assistance
Earnings,
income and so on.
Unemployment.
wages, unemployment.
What about the flip side? I mean, people who own 2 or 3 houses. So I'm thinking of Lake of the Ozarks and just watching that over the decades. And for some people that's their second or third, residence. But then I'm thinking about the people who actually live there. And if you look at the income distribution, it's bimodal, seasonal bimodal distribution, and that disparity that then causes problems.
Yeah.
So I don't know how.
Yeah, I mean,
That's a different type
we
of.
also have measures of income disparity, and that's something that you can roll up and say, well, this county has higher disparity than this county in terms of income, but it's hard to see that in those specific terms.
I'll go ahead and write it down. I'll let you figure it out. You're smarter than me when it comes to that. I just know it just causes problems. So when you have that disparity, and there's unequal tax burden, just ain't right.
Yeah, yep.
I'll leave it at that.
Linnell has some thoughts too. She said, of course, I guess I could just somehow share this with the group. Oh, technology. Unbelievable. Of course, my opinion is going to be biased based on my own orientation and might not be relevant to communities. That being said, any data under the categories of maternal child health, vaccination, challenges, tracking flu shots, HPV, routine child vaccinations, etc.
Great.
Is there something at living wage? or I guess income would be,
Living wage is great information. We've got that for Missouri. We used to have that for Missouri.
We have it.
because it's a composite, isn't it? I mean, of income versus how much it costs.
Versus affordability, yeah,
And it's segregated by household size.
Yeah, so it's,
1, 2, 3 bedrooms.
yeah.
You know, so I think, you know, what Linnell's comment about behavioral services for veterans, a lot of them have adverse mental health outcomes because of their work situation, employment situation. So, I mean,
Yeah.
especially if they're in the Guard or Reserve and experience multiple deployments, but it's purely an economic reason as to why they're in those situations.
Yeah.
And that typically gets back to some type of living wage type of situation. It's always, you know, that's the dependent variable. What are the contributing factors? Starts over here. So.
Yeah. Okay, well, I think that's great feedback. If you have stuff jotted down, we'll collect that at the end here. Melissa, we'll turn it back over to you, and we can go over some of our next steps and give some feedback on what our
jurisdictions or.
Oh, jurisdictions. Yeah. Yes, if you have any other thoughts on jurisdictions too, it would be great to hear them. We heard, you know, ambulance districts. That there are a number of health districts that don't always correspond to each other, unfortunately. Like mental health districts are always not always the same as the children's health districts and school districts. So if there's anything particular to health and safety that should be included in that list, we'd like to hear that as well. And you don't have to write it down now. We can take it over email as well.
Probably should have that in the next several days, though.
Right.
By
Yeah.
the 7th, I think we were saying.
Yes. Yeah. So we've got we're trying to distill all of our information here into a report by the 11th. So a couple days before that would be great.
So for 2019, we plan on having a multi-phase build, which we'll figure out hopefully by December 11th, how that will roll out. And we've heard from Blake that we need this governance group. He's been really excited about how the impact teams have been formed and all the information that's come out of you guys. And so he suggested, heavily suggested that we have a governance group going forward. And so whether that's you all or if there's other people that we're missing that need to be as part of this, and we haven't figured out what the best way to do this, maybe meeting in 6 months after there's a build and something to showcase and then review it over email if there's any big questions that we have. So that's one part.
And also taking an ongoing pulse, as you're hearing things in the field or
Mhm.
how CARES is pushing out the tools and et cetera. Any comments, what we need to do to change, that would be great.
Yeah, and we intend to continue our field studies and other things, and we want to understand what are the barriers to adoption for all things Missouri, what things people need in the field at least, but we don't necessarily have our pulse on or have our fingers on the pulse of everything. So we really look to you guys to.
Right, so the ongoing commitment may not be as intense as it's been the past 6 weeks with these meetings and homework, but we would certainly invite you to continue to participate. And if there's reasons you can't, let us know, but we definitely would value that input. And as we value the input you've had today.
Yeah, I would like to be included in future plans.
Great.
Great, thank you. Awesome. And we also had this idea of monthly brown bag lunches. So basically getting on a Zoom call, especially with the CESs and folks that are our target audience within Extension right now, field staff, CESs, folks that will be using this on the ground. And as we start rolling things out, you know, once a month, do a talk on, oh, this is how you use the query tool. Let's talk more about this. And then coupling that with people in the field, you know, our heavy users saying, hey, this is what I've shared, this is what I've done. Having them kind of drive the expertise in some of these starter maps and some of these reports. So any thoughts on that or things that we should include that we're not thinking about? in a monthly talk with CES and other folks in Extension. Something to think about too, going forward.
I mean, just have a Google Analytics report ready to share.
Cool,
with
okay.
folks.
That's a great idea.
Yeah.
And something, I have to talk to Shirley about this and see what she thinks about it, but I don't know how much at the conferences that outreach does, nursing outreach does, but it lets the nurses know at all those conferences. That gets us anywhere from 60 to 120 nurses
Awesome.
every time there's a conference. And letting them know about CARES and some of the, what's available.
Right.
Have them use it and see what they think. They are the users. Great.
Right, yeah.
They
That's
are,
a good idea.
they are our audience.
Great.
Yeah, that's great. So the other points on here are specifically around our support material development. I would like to know from your all's perspective what types of support materials would be most useful. So, thinking about recorded webinars, 5-minute clips, tooltips for when you start to use a tool online, PDFs that explain how to do different things, Canvas courses to give you, you're a certified map maker.
Also promotional materials. Yesterday it was mentioned it'd be great to have a handout that I could give to people when I go to accounting.
Right. So what support materials from your perspective would be most useful? And I think some of this we'll get from feedback from some field users, but I'd love to hear your thoughts as well.
How-to videos.
Yeah, 2 videos.
That's where you're going to get them. I can't get my students or myself to do anything else except, click on the video and there you go.
It's funny talking to people in the field because people are so polarized about that. Many people are like, oh, if I can't find it on YouTube, I'm never going to learn. And some people are like, I hate videos, I will never watch them. It's like, oh, really? Such a big split. Yeah, and it's like across the age gap too, age gap, whatever age range. Yeah. No, it's interesting. Like I never watch videos personally, and I thought it was just me, but nope.
Well, see, you're smart.
And like taking the time to.
But you can fast forward and you can modulate the speed. I mean, people who are like well versed don't want to waste some time on a video. But if it's something you haven't done before,
sure,
then I'll do the video.
It also depends on how brave or aggressive you are. If you're the type of person who likes to get in and just break things, then you're not going to watch the video. You just start poking around and then complain. Why didn't you do what I wanted?
Yeah, it depends on what it is. Some things I like to
Thank
do.
you.
Right.
Yeah.
So,
And I'd would like to continue participating.
Great, thank you.
We'll keep you on the list.
All right.
And folks on the phone, same invitation to keep participating. Let us know if you want in or want out. Where are we going?
Send us an email if you want out.
Yeah.
You don't have to submit on the phone.
So, yeah.
Anything in particular around support materials or outreach? Different ways
Yeah,
that you can
I was
communicate.
just thinking for the folks that we deal with, actually just something in writing, something, a piece of paper, take away. Partly because a lot of the people who we access are face to face.
Yeah.
And you can tell them a web address and that's great and they may write it down, but they really need it written because they're physically there.
Right.
And a lot of people like something to carry away.
That's
Yeah,
what
and
I'm
it's a
told,
reminder.
or even a little card that just says it.
Yes,
That you
actually,
take,
yeah, it doesn't have to be some big fancy
Big,
sheet of paper, but just something.
And are we going to get Will Ferrell to do our voiceovers for our videos?
That's should be part of our budget. Chris.
There you are. You hear that, Chris? What's that? We need budget to get Will Ferrell to do our voiceovers.
We'll do it for free.
Oh, okay.
I was gonna say, I'd do it a lot cheaper than that. Whatever he costs.
I think I would rather have Morgan Freeman do it.
That's
Morgan
true.
Oh, he's got a great voice.
Right?
Yeah.
You're really soothing.
Yeah, there you are.
We should get celebrities to sponsor some.
Yeah, there are probably some who would be.
Yeah, who's from Missouri? Brad Pitt, right?
There you go.
Brad
Yeah, don't
Pitt.
you know he'd do it?
Yep, don't know, is that a good thing?
I don't know.
or not?
I don't know. I think
What
it's
you need
kind
to
of
do is get somebody that's been,
Cheryl Crow is from,
yeah, Cheryl Crow from Southeast Missouri, that you get somebody that's been sentenced to community service and having to do this community service,
And bring in a positive attitude,
Yeah,
force
right.
them into doing it.
Well,
Okay.
any other ideas on the phone?
And feel free to send us an email as well if you have any thoughts. Just try to get it in before the 7th, so we've got time to incorporate into our report and our plan for the next year.
Sounds good.
All right.
All right, thanks you all.
Thank you.
Have a good day.
Thank you.
Thank you.